Obesity increasing esophageal cancer, stomach cancer, colon cancer, liver cancer, the lung issues, so many things. Almost all the cancers are obesity based. If you look into that, one end I said the fatty liver, another end I am saying the obesity. So both are interrelated. The fatty liver problem, it's not the problem of India. World level, the prevalence in the sense, fatty liver not causing the liver disease alone. Most of the common cause of death, fatty liver disease is not the disease of the liver, it will affect the heart. Nowadays, we are seeing the more and more liver cancers. Even though we are not having diabetic, we are more chance to get a fatty liver. Even though we have the hypertension, there is chance to get a fatty liver. High sugar within the liver, it itself change to the cholesterol. One is the sugar, another one is the ALT. If both are abnormal, 80% chance of to get into the future liver cancer.
Ladies and gentlemen, please join me in welcoming a visionary leader and compassionate healer, Dr. Joy Verghese.
Respected ladies and gentlemen, good morning to all. So I'm really happy and it's an honor to me to be here along with you. My sincere thanks to CSR. I am holding the transplant program for I'm involving in the field more than 18 years. When we started a career, most of the patients, we had done a liver transplant due to alcohol. So drinking alcohol, they will come with a liver problem, liver cirrhosis. Approximately we are doing more than 100 liver transplant in a year. But in the last 3 years, if I look into our own data, most of the reason for liver transplant in adult are fatty liver disease. It comes to in our center alone more than 60%. So not only in our place, if you look into the world level data, I am going to show to you and a few of them, but mostly the technical word, I will try to simplify in my own way. So we all think about which was considered initially not a disease. The fatty liver, if you go through, even I am remembering in my college days, I have not seen a scanned report of fatty liver from the radiology department. But whenever now I am going to see the scan report nowadays, not only myself, all the practitioners, they are seeing the fatty liver problem. Irrespective of the age, middle age, youngsters we are seeing, and the gender. So irrespective of the age and gender, worldwide now it's going to the, So it's just a global prevalence. As I already mentioned, the fatty liver problem, it's not the problem of India. World level, the prevalence in the sense, it is the old data, so it is the previous few years ago. In India, they are mentioning 9% to 53. So what is the meaning of 9 to 53 mean? Some of the states have the less fatty liver, but some of the states have the high fatty liver. That's why hilly region, so most of the time the data from that area shows the 9%, and Andaman Nicobar, that region, that union territory comes a low fatty liver, but close to more than 50% enter the South India and the Punjab and the Northeast, it comes the Kashmir, Jammu and Kashmir, all goes to the high level of the fatty liver problem. So why? I'm the hepatologist, liver specialist, but this fatty liver, it's not causing the liver disease alone. Most of the common cause of death in a fatty liver disease is the cardiovascular, that means the heart attack. So whatever now I am saying to you, everything with a proof, but I am not going to the literature so much because the world level literatures are more and more. So why I am saying the fatty liver, to create a liver problem, it will take many years, sometimes few decades. If you are identifying fatty liver at the age of 30, it will take minimum 20 years over the period of time goes to the cirrhosis and thing. But the 30 years, the age old of the individual seeing the fatty liver, the cardiac mortalities are more. So, we have to look into that. Fatty liver disease is not the disease of the liver. It will affect the heart. And one more data I wish to tell to you. Nowadays, we are seeing the more and more liver cancers. They will say, I'm not alcoholic, I'm a teetotaler, but instantly going for the scan and it shows some of the tumor in the liver. Then they will get surprised. They will ask the doctors a question, why I got the liver cancer? That mostly the 90% of, so what we will do, while removing the tumor, we will send the tumor to pathology, all the tumors. So the report mostly comes that liver cancer in the background of fatty liver. So the science has advanced, what are the pathways involved normal cell converting into the tumor cells. So the cancer mean abnormal cells. So normal cells converting the abnormal cells, what are the fat droplet which has been deposited within the cell, how it is altering the cell function and it is creating the cancer. That kind of the studies, entire world level, they have done. Now the treatment part, how to arrest the pathway, that kind of the most of the chemotherapy or immunotherapy related studies are going on, how to cut down. So fatty liver disease, the most common nowadays, unfortunately, indication for liver transplant. Young people, it is the most common cause of the cardiac problem, and it's creating the most common cause of the liver cancer also. So this is the prediction, the NEJM. So doctors, most of the doctors know. So they predicted in 2040 how the world level, the fatty liver disease burden will be there. If you see almost Asia, Europe, North America, it's crossing more than 50%. So WHO normally classify the disease in two ways. One is the communicable disease, another one is the non-communicable disease. Communicable disease means, from one person to will go to other person. Example is the COVID. Okay, there is the viral infection. These are communicable disease. In non-communicable disease, it will not from one individual to another individual, it will not get transmit, but it is a high. Earlier, the non-communicable disease, the diabetes, hypertension, everything was there. Nowadays, they are predicting, even though we are not having diabetic, we are more chance to get a fatty liver. Even though we have the hypertension, there is chance to get a fatty liver. Not a cholesterol, blood cholesterol will be normal, but the scan will show the fatty liver. So, world level, the WHO says, in a non-communicable disease, the fatty liver will be the number one in the future. We all now, as to science, evidence-based, have learned that it will not affect the liver only, it will affect other organ also. So this all looks like a panic, but the good thing, fatty liver is completely reversible. That type of steps we have to take. We have to educate our future generation. That's why, even though it looks like alarming, but if we start at a step at home, our home, individually, our family, that's more than enough. These are common slides. Earlier I used the things that viral will affect the liver, alcohol will affect the liver, sometimes the genetic marker, some of the disease will affect the liver. But as I already mentioned, fatty liver, whether the patient have obese or hypertension or with or without diabetic, it will cause the problem. Diabetes per se will cause the fatty liver. That's why always nowadays try to convey the message, better keep the sugar level or HbA1c level under control. Otherwise, that high sugar within the liver, it itself change to the cholesterol. That is called triglyceride. So the fatty liver means, if you look at, there are the fats, so many their molecular structure wise, so many types are there. Triglyceride, LDL, HDL, everything. First, the sugar will get converted into the triglyceride. This triglycerides are notorious. It is causing the problem. So diabetic people and the high cholesterol irrespective of the age, because some people, even the middle age, due to the genetic problem, familial. So diabetes is a familial history. Cholesterol, hypertension. Unfortunately, Asians are more prone to get this kind of a problem, the diabetes, cholesterol. But at the same time, changing our lifestyle, diet habit, regular exercise, somehow we can control or somehow we can postpone the disease. Instead of getting at the age of 50, we can get the disease even the later stage. And if our family member have the high prone to the genetic problem, we have to take adequate precautions. So normally the healthy liver will not have any fat. If you are taking a biopsy from the liver, looking into the microscope, there will not be no fat. But the disease, our lifestyle, everything, whatever I mentioned, slowly it will go to fat droplets. That fat droplets will start to damage the cells minute by minute. Over the period of time, it will go to cirrhosis. Cirrhosis is irreversible. So I said fatty liver is reversible. If we know we have fatty liver, we have to take adequate precautions. Then 6 months or 1 year or 2 years time, we can show the reversibility. But once you enter the cirrhosis, that is completely irreversible, that group only going for at one point of the time the liver transplantation. Some of the cirrhosis will lead to the liver cancer, but as I mentioned earlier, even without cirrhosis, simple fatty liver will cause liver cancer. That we have to keep it in our mind. So there are the liver function tests. Just if you go for the LFT, liver function test, normally everyone will look into that serum bilirubin. And if the number is high, they will come to us, sir, my blood report shows the jaundice, whether I have a jaundice or not, because their concentration mostly will be on the bilirubin level. That goes high, obviously it will cause jaundice. But there are so many other tests, as CS already mentioned, ALT or AGPT. If you check your LFT, liver function test profile, ALT is important, AST is important, GGT, GGT, that is important. This kind of the things, when I was in MBBS period, they said whenever this LFT altered, you have to think about liver disease. But now, whenever any alteration in the ALT or GGT, we can predict heart problem, we can predict cancers, we can predict other organ dysfunction. So, initially, whichever the test was notified to assess the liver function alone, now it started to predict other organ dysfunction also. So the simple, actually it's I will explain this one, then you can get it. Initially I told fatty liver people are more prone to get a cardiac problem, heart attack, youngsters. If you look into that in the LFT, ALT1 test, if it is abnormal, this all the epidemiological study, it shows they are more prone to get the cardiovascular disease. Cardiovascular disease means, simple way I can say heart attack. So, ECG, echo, CT angio, these are the high-end tests to know the cardiac disease. But simple, the test, ALT abnormal, not only think about the liver problem, it will create a more and more cardiac disease. These are all the published in the high indexed journal at the proof. And after that, so many countries, not only the Western world, even Japan, most of the countries has replicated the same study and the population based study, and they came to know we can use is as a predictor. High ALT doesn't mean heart attack. Just we have to understand it is a predictor. It is predicting means future we are more prone to get a cardiac disease, a predictor. Suppose chest pain comes, that time checking ALT will not be helpful. That time the test for troponin I and P, so many other tests, ECG, everything will do that. But these all predictor. So if we are seeing the test is abnormality, we have to go ahead for the taking a precaution, not only liver as well as for heart. So there's so many other British medical journals, and these are the high cholesterol from the American Journal of the Preventive Cardiology. So just highlighting, most of the upcoming studies, epidemiological, everything has proven this test will be the predictor for the heart disease. This all the so many studies for that. And the other thing, this one, all-cause mortality. So far I mentioned there is all-cause mortality, meaning if you take whatever the type of reason, there is the patient's mortality if he shows high, that is called all-cause mortality. The patient can die due to cardiac disease, patient can die due to liver disease, or patient can die due to the renal disease or brain disease, tumor, or the overall the cancer. So I said ALT is the predictor of the cardiac disease. Now the papers are started to come out. This ALT is predicting all-cause mortality. So if it is abnormal, it's our duty why it is abnormal, what type of disease we have, whether it's a disease or still it is our lifestyle related the issues, or anything we are taking some unwanted, the medications also sometimes will cause the injury. So we have to look into that, the reason, and we have to go for correction. If we correct it, because these are the one form of liver enzyme secreted from the liver cells, whenever the liver cell gets damaged, it will get released into the bloodstream. That's why in the blood test, we are easily to identify this kind of the changes has happened. So this is the one of the important, I am highlighting all-cause mortality, this is the one. Similarly, these all population studies, so many things are there, okay. So there is other test called this liver cancer. Liver cancer, how we can predict whether future I will get the liver cancer or not. These are recent epidemiological study taking the two parameter, one is the sugar, another one is the ALT. If both are abnormal, 80% chance of to get into the future liver cancer. So these are all the way, that's why the synergetic 74%, they are high risk to develop the cancer. So why I'm insisting all the things, once the disease comes, we can reach for the high-end technology-wise, the treatment part, whatever the best, we can get it. But we have to think about the preventive strategy before to get it, and we have to think about our future generation. So this, most of the time, it is based on our lifestyle modification, that we can discuss that one is a bigger way, how the type of food we are having, for what are either vegetarian or non-vegetarian, how our lives is going for sedentary lifestyle. So these all is nowadays is making us more sicker, and it is leading our entire population into the future big disease burden the country, and at one point of time it will affect our personal life, at the family life, and the entire the nation. So the prediction only by high sugar and high ALT, if it is persist for many years, 1 or 2, suppose our lab report 2 years before it shows the high sugar, high ALT, today we are going to do the test that also shows high, then we have to be more cautious about this future. In another 10 or 20 years time, there is a more chance to get the liver cancer. So that's why these are high population. This study, they have done almost close to 1 crore population. This paper, I dropped it, 1 crore in China, they studied it and they published it. So we have to think about whenever the more population wise they are going to study, the accuracy of the result will be much higher. Then the obesity, whether we have this a big burden. So obesity here I'm meaning BMI. We all should take care of the BMI, but the BMI is the one form. But my suggestion to all of you, waist circumference will be the better marker than the BMI. BMI means body mass index. Based on our height and weight, we will calculate. Another simple thing is the waist circumference. The male, there is a more than 90 centimeter, and the female comes around 100. So this kind of the more than the waist circumference will lead to the liver problem. Not only the obesity will increase all types of cancer. If you see the pictures, almost all organs in our body, each one based on the research paper. Obesity increasing esophageal cancer, stomach cancer, colon cancer, liver cancer, and the lung issues, so many things. Almost all the cancers are obesity based. If you look into that, one end I said the fatty liver, another end I am saying the obesity. So both are interrelated. At the same time, sometimes even though not obese, that time we are seeing the fatty liver. But not only fatty liver, and it is causing the all types of the cancer. These all we have to understand. Again, obesity, even though we'll say some sort of genetic factor will play, most of the time obesity also based on that our lifestyle. So we have to correct again and again in this forum. I wish to insist, lifestyle is good for us, good for our family. And the GGT, so far in a liver function test, I gave the importance of the ALT or AGPT. Second, I said how the high sugar will cause the problem. Third one is the GGT. This paper is published in the one of the high indexed journal. High indexed journal means they will not accept the paper without much proof, because there is a standards are there in the world level, the journal, okay. The high indexed journal will go for so many, the peer reviewed by the experts, and everyone will go through that, then only it will come to publication. That's why it is coming. GGT is nationwide study they have done, that also shows the all-cause mortality. So here ALT, how I mentioned, and the GGT, these are the small tests, even 100 rupees, 200 rupees in a routine lab we can do it. Whenever it's abnormality, it's our duty to find out why the abnormality it shows in my blood test, what could be the reason. We have to consult. Most of the time it will not be a disease, most of the time it will be our lifestyle related. If it is a disease, then we can go for the better treatment. Suppose thyroid disease patient, hypothyroidism, they will get the fatty liver. That time, simple lifestyle modification will not help to correct it. They have to take a thyroid hormone, either L-troxin or thyroxine, so many thyroid hormones are available. So similarly, high cholesterol means lifestyle modification, and we have to take a lipid lowering drugs are available. If a diabetic, we have to consult a diabetologist and we have to change. The same way, if always the lifestyle modification will combine with that the medication, but sometimes we will not have diabetes, thyroid or obese and other things, but simply will have the fatty liver. And that time the ALT or GGT, if it shows high, that needs lifestyle, importance of the lifestyle modifications. This all, if you see, this also almost close to the almost 96 lakhs 87,000 population related the study of them. If you look into that again, each one shows the all-cause mortality, cardiovascular disease and cancer. So now I think you will get a surprise that simple few tests are started to predict the overall cancer, not one organ specific, it is all over the body. So that's the way, it's a simple test. If it is predicting, mean we have to understand and we have to give a importance to the test. That is the message I wish to convey there. So all type of cancer mortality, liver disease mortality, see the respiratory. This GGT is the liver function test, but it is predicting the respiratory disease related mortality, heart related mortality, etc. The GGT, because this one, the green side, when I was in 1990, that time the college student, that time we will give a important, if the GGT is high, my professor, the question, favorite question, what are the causes for rise in GGT mean? We used to say alcohol consumption. If those who have been recent alcohol consumption, that after that if you look, the GGT level will go high. But now GGT is not only due to alcohol, it will cause due to the controlling the various organ dysfunction also. The science has changed. So now the examiner, if you ask, they have to tell all the reason the students. What are the things we have to do to maintain ALT level or GGT level? So number one, healthy diet. Healthy diet, in simple way I can say, better to use the less carbohydrate diet. Have more and more protein rich diet. That is the meaning of the healthy diet. Alcohol consumption better to avoid, because alcoholic people will get only 20% of the people get the liver problem. Remaining 80% of the people will not get a liver problem. Okay, liver cirrhosis, everything. That's why even though so many people are consuming alcohol, so very few are getting the liver cirrhosis and going for the disease. But still, who are the 20%? There is no test to predict, okay, if I drink alcohol, whether it's a safer to me or not. There is no separate test. So better to avoid the alcohol. Third, regular exercise. Nowadays, this regular exercise, the importance are keep on going. So many yoga, etc., diet wise and other things. So regular exercise is very important. Whatever our job, so we have to spend, and the same thing we have to educate to our children and the next generation also the importance of the regular exercise, because by doing the regular exercise, we can revert back that we can, whatever the fat deposited, we can revert back. One example I can say, as we are doing a liver transplant, living donor, the donor liver should be normal to donate a part of the liver to their beloved one. If the donor liver is a fatty liver, they can't donate. We will say, you are not fit to donate, bring another donor. So they will ask how to reduce the thing. So that time only we will advise high protein diet and the regular exercise, go to the gym, do the regular walking or cycling, swimming, etc. So that's the way we will be. After 1 month later, if we redo the scan or repeat the blood test of the liver function, everything will show the reversibility. So then we will allow them to donate their part of the liver to the beloved one. So both the liver will regenerate, grow in 30 days. So the regular exercise is very important. Avoid unnecessary medicine, that is very important. So many thanks for giving this opportunity to me. Thanks very much.
Thank you for your patience. And now it's a question and answer session, and it's for 10 minutes. 4 questions are allowed. So I would like to welcome Mr. C. Sivashankaran onto the stage to join with Dr. Joy Varghese. Please, sir.
If you don't want to meet Joy for the rest of your life, I will give you tips. And I will answer only preventive questions, and Dr. Joy will answer the technical questions. Now, please ask up to 10 questions. We will do it faster. And then, whatever we reply, we are going to call one of you to come and ask you questions what you have understood. And if you answer it correctly, you get 1 carat D-colored diamond, VVS1, and the price is 54,000, not 35,000 as advertised. We specifically said 30,000, 35,000, because then we thought so many people won't ask for it. Okay? Now let's start, please.
Dr. Radhakrishnan, retired professor from IIT Madras.
Yes, sir. Yeah.
going to school, has got a liver problem.
Yeah,
His mother is worried that the doctor has advised liver transplant.
yeah,
Will it really happen in young children?
yeah.
Liver transplant is necessary.
Doctor,
See, normally the pediatric transplant, pediatric means less than 16 years old individual babies or children will do. Most of the time it will be genetic disease. There are few genetic diseases, or I can name it, but it will not be useful to this audience. And whenever the doctors are going to say liver transplant, I am sure they would have been tried maximum with the medical management. They will not say immediately go for transplant. Usually no one will tell. They would have been tried maximum with the medical support, and if medical management fails, then only they will do the transplant. At the youngest age, even in Chennai, we have done even the 2 months old babies. So if you take the Western literatures, they have done even the 5th day after the born, the baby born, so the newborn baby, they have done a liver transplant. So another beauty, whenever we have done the liver transplant, that liver will take their entire life. It's not the 5-year survival or 10-year survival, 20 years. The liver is the God's gift. It will regenerate. It will go for the entire life.
So, what is the cause of liver failure in young children?
Okay, so as you are asking specific, I can ask the specific. One disease called the biliary atresia. That means from the liver, normally the bile, the juice, the production of the juice will come through the duct and will go to the intestine. That is called bile duct. It will not be developed in the children, some of the newborn. That is called biliary atresia. That is the most common cause of the liver transplant in India and the Western world. Normally they will do the Kasai surgery, one type of surgery, temporarily to sort it out to the babies. And if it fails, they go for liver. That is the most common. Second is the Wilson disease. There is been excessive copper. This is also genetic disease. Copper deposition in the liver. The excessive copper will affect the child. Third is the PFIC. There is a progressive familial intrahepatic cholestasis. These all genetic. So mostly in a pediatric, less than 5 years, most of the time, whatever I said, these are things. More than 5 years, so many factors involved. Like the adult, like some of the virus will cause some of the disease.
yeah, please ask any preventive question. Go ahead.
This is Dr. Vignesh actually. So, sir, I have 2 questions for you. So,
Please.
one thing, like, as doctors, shouldn't we be stressing more on the effect of sugar on the liver rather than keeping stressing on the effect of alcohol on liver, sir? Because alcohol comes with a warning, like due to the age factors and all those. People tend to know that alcohol causes liver disease and all that. Whereas sugar, it doesn't come with any warning, and there is literally no age restriction. Like babies who are born, so right from day one, like there is no specific like a rule or something that says like babies or kids should not be given too much of sugar. These days, I feel like we should stress more on the effect of sugar on liver rather than keeping stressing on the effect of alcohol on liver. I understand both are toxic to the liver, but then the sugar is more like a silent poison, I feel, sir. What is your take on this, sir?
Doctor, instead of asking question, you give an answer, question, judgmental, lawyer, client. In future, please ask only questions. Let me answer. There's a saying in English, between a frying pan and a deep sea, which one you want to fall? In both you die. So sugar and alcohol both are same. Alcohol now it is fully certified, given at 4 ml of alcohol is harmful to your health. Okay? It is poison. So don't drink alcohol. Sugar, let us address fructose. The only reason your liver get into problem is you consume too much of fructose. Fructose can be ingested only by liver. Yes, doctor? Yeah. Whereas glucose can be injected throughout your body. So if you take more than 43 grams of fructose, 2 cola bottles a day, it is enough for your liver to become fat. All of you will have fatty liver. Make no doubt. But there is a very easy way to come. The first easy way is fast mimicking diet. Eat only 750 calories, less than 25 grams of protein, eat between 4 hours and do it for 5 days. okay, your liver will start coming. In fact, when we designed longer, live younger, actually we wanted to say live younger, you live longer. Okay? And very easy to treat fatty liver. But the medicines in America they are developing is going to cost for fatty liver $280,000 per person. Just do, go to internet, search 5 days fast mimicking diet. Okay, or we will give you a sheet today to all of you. And all of you can have a free fatty test with Mr. Artiscat, Mr. Gonzagan is here. Okay, and we will pay him. Okay, please go, show your registration, okay, and take one fatty liver and come to us. We will reduce your fatty liver. What is the proof that we reduce? One is blood test. You can look at your values of gamma DT, ALT, AST. Second, you can do your ultrasound. The best way I did, that is why the first visit to Global Hospital I went is, I did MRI elastography, looked at the stiffness and everything, and I made sure I have zero, I don't have fatty liver. At the age of 68, if I don't need to have a fatty liver, you also can remove your fatty liver. And if you want fatty liver, don't want to become NASH, there is a simple principle. Take a green tea extracted taurine and have a drink. No doctor in the world can predict when your fatty liver grade 2 can become NASH. Okay? So please take this drink. Taurine is available with us, very cheap. Okay? And a non-essential amino acid. Taurine alone taking 2 grams a day will increase your lifespan by 15 years. So please try that.
Sir, if you were to name just one best food for reversing the fatty liver, what would that food be?
One food is no food. If you don't take food for 5 days, your liver will be okay. But if you want to take food, take curcumin.
Curcumin.
Along with piperine for 200 times more absorption.
Thank you, sir.
Next question. Last question. Huh? Thank you. I'll see you.
Thank you, sir. Thank you so much.